In today's video, I'm going to be giving you a little insight into private practice. I'm going to be talking through what private practice actually is, the benefits for patients and for you as a healthcare professional. I'm also going to be talking about some of the cons to working in private practice as a GP and some of the things that you should consider if you're thinking about going into the private sector. Hi everyone, and welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. On my channel, you'll find loads of useful content to support you on your medical career journey. As always, if you liked the video, then make sure you give it a thumbs up. And if you haven't subscribed, then make sure you hit that subscribe button. And don't forget to turn the bell on so you don't miss out on any new videos. So what is private practice? You could be an NHS or non-NHS GP working independently, working in a private clinic, or as part of a company such as Spire, Bupa, or Nuffield Health. As an NHS GP, you can also work in the private sector as a private GP, and as a GP working in the NHS, there are many things that we do which is non-NHS work. I've spoken about this in previous videos, things like medicals and writing letters to outside organisations. So what are the benefits for patients? Well, patients can opt in and out of NHS care. Now, if you are treating a patient in the private sector, usually they will have a GP. If not, then you may be the only doctor and therefore solely responsible for their care. Patients can choose which consultant that they want to see and therefore have more continuity of care than arguably they could achieve in the NHS. And more often than not, patients won't have to wait a very long time to receive the treatment that they need. If you want to know a little bit more about this, then check out an earlier video in the series, The Patient's Perspective. Charlotte, who was diagnosed with rheumatoid arthritis, was seen very quickly when she went into the private sector. Facilities include private rooms, and if you are an NHS patient, there are some exceptions to this, but more often than not you will be on a ward with many other patients. So there will be a contractual agreement between the patient and the doctor or team of doctors, and this requires the informed financial consent of the patient. So it is important for the patient to communicate with their GP in the NHS about any private healthcare they've received. Now, it is important for obvious reasons for the patient's GP to have a clear understanding and record of what has taken place in the private sector. So how is a private practice funded? Well, many patients will pay themselves in addition to paying their taxes. They can also claim through private medical insurance, and as part of some employment packages, private healthcare is offered. Now, the doctor's contract is always with the patient, which means that it's the patient's responsibility to ensure that the doctor's terms and fees are met. So, who can undertake private work? So any doctor fully registered with the GMC, General Medical Council, can undertake private work. And this is in accordance with the provisions of the Medical Act 1983. However, doctors with provisional or limited registration cannot practice without supervision. Okay, so let's get into the pros and cons of working in the private healthcare sector. So in terms of the pros, some people argue that you get more time with patients, so this may be anywhere between 15 and 30 minutes. You have more flexibility and autonomy. There is no NHS regulation, no QOF targets, less government input or interference, some may say. And because of some of the above, some people would argue that you would have a higher job satisfaction working in the private sector. And as a GP, you will be able to build more close relationships with consultants who you'll be able to refer patients to. And in some cases, some private prescriptions may be cheaper. So what are the cons? Well, according to the BMA, Private and NHS treatment should occur at a different time and place. So from what I remember being told as a GP trainee, if you are in an NHS GP surgery and you do work in the private sector, you cannot essentially advertise your services in that GP surgery. And according to the BMA, you shouldn't be doing your private work in that same place at the same time. So you only get paid for the services you provide, and you will of course, like with running a business, have expenses. Expenses will include funds to set up practice, any staff you may need, tax requirements, as well as of course paying yourself a salary. So in terms of setting everything up, you may be at a loss or have a deficit in the beginning. So it may take some time for you to achieve the amount of money or achieve the earnings that you foresaw. In terms of the patients seen in the private sector, if you do want to see babies and children, then you'll need to make sure that you provide a full range of assessment services and a schedule of vaccines. Again, the NHS still provides the majority of care for elderly patients who have complex needs, because this can prove to be very expensive privately, and there just aren't the same services and MDT or multidisciplinary teams available. Now, like we heard earlier, prescriptions can be cheaper. However, more often than not, they are much more expensive than the NHS alternative, especially for chronic conditions. So sometimes patients will be seen in the private sector and then go to their NHS GP to ask them to prescribe a medication that was prescribed or advised for them to take by a private doctor. Some people argue that there are higher demands in the private sector. Patients may expect a bit more from you. They may expect a higher level of service. They may expect longer times with the doctor and same-day appointments and time with you out of hours, and so greater access to that doctor. And so in terms of just going back to finances, patients can be invoiced after their appointment or treatment. And so with invoices, you have to wait for the person or the patient to obviously pay you, which may take some time. Some practices will employ debt collector services. And also in terms of your NHS pension, you'll have to make private arrangements for retirement. So there are a whole list of other things to consider, like the business structure. Are you going to be a sole trader or a limited company? What about a limited liability partnership or LLP? There are a number of pros and cons with this structure. Other things to consider are registering with the CQC, contracts, finances, bookkeeping, staff, hiring staff, getting the right staff, indemnity, choosing exactly where you're going to work, so the premises that you're going to be consulting patients in, advertising and marketing, especially if you're just starting out and no one knows who you are. You also have to consider your appraisal and revalidation. Finally, a word on earnings. You have to take everything into consideration, so it's very difficult to place a set number of earnings or a figure on how much you could potentially earn working in the private sector. Like I've said before, it is what you make it. It's very variable. There is potential to do very well. However, like I said, there are many things to consider. So that was a taster into the private sector, a few things that you should be aware of if you are considering working into the private sector, whether now or into the future. As always, if you like the video, then make sure you give it a thumbs up and subscribe if you haven't already. I will see you in my next video.